नमस्ते बिटिया, हमेशा खुश रहो बिटिया. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, Faculty of Homeopathic Science in JAYOTI VIDYAPEETH Women's University, Jaipur. Today we are going to start with infectious diseases, viral infectious diseases, and in today's lecture we are going to discuss about mumps. What is mumps? What are the symptoms, causes, diagnosis, and treatment? All these things we are going to discuss in this lecture. Mumps is a very common infectious disease that is commonly encountered in our day-to-day practice. It affects a lot of individuals, especially children and also adults. Mumps is an acute systemic communicable viral infection that is characterized by swelling of one or both of the parotid gland. So what is mumps? It is an acute systemic communicable viral infection that is characterized by swelling of one or both parotid glands. What is the causative organism? The mumps is caused by mumps virus, that is a negative strand non-segmented RNA paramyxovirus. The children of age group 5 to 9 years of age, but is more severe in adults. So it commonly affects the children, especially of 5 to 9 years of age, but if it is affecting adults, then it is more severe. It is basically RNA paramyxovirus. How the mumps is spread? Mumps is spread by respiratory secretions, droplet infections, direct contact, and by fomites. So it's spread by the respiratory secretions, droplet infections, direct contact, and by fomites. The peak season is winter season and in spring. This is the parotid gland. So in mumps, there is swelling of the parotid gland, either one side or both sides of the parotid gland. This is the picture of the paramyxoviridae mumps virus. Now incubation period. Incubation period of mumps virus is 15 to 24 days with median incubation of 19 days. The patient are contagious from 1 week before to 1 week after the symptom onset and are also most contagious 1 to 2 days before the symptom onset. Now, what are the symptoms of mumps and what to look for? The symptoms of mumps includes fever, loss of appetite, headache, muscle pain, pain while eating, pain in the ears, jaws, chin, pain on both sides of the face, and swollen cheeks or jaw. How it spreads? Mumps virus spreads by airborne, by coughing, sneezing, by saliva, by kissing, sharing drinks, and by touching contaminated surface. On the right side, you can see the normal parotid gland and the swollen parotid gland, the swelling in the parotid gland. Now, what are the clinical manifestations of mumps? In mumps, up to half of the infections are asymptomatic. So if the patient is suffering from mumps, in 50% of the cases, the infections are asymptomatic. The prodrome consists of low-grade fever, malaise, myalgia, headache, and anorexia that precedes the development of parotitis and lasts for 1 to 7 days. There is unilateral or bilateral parotitis lasting for greater than 2 days, presents in 70 to 90% of symptomatic infections. The patient with parotitis have difficulty in eating, swallowing, talking, and may have an earache. There is glandular swelling which disappears within 1 week. Now these are the symptoms of mumps. We have fever, loss of appetite, headache, muscle pain, pain in the ear, jaw, chin, pain while eating, and pain on both the sides of the parotid gland. Now, what are the complications? The complications of mumps includes epididymoorchitis. It is a common manifestation of mumps, and it is developing in 15 to 30% of the cases in post-pubertal males. Orchitis that is characterized by painful, tender, and enlarged testes. It is bilateral in 10 to 30% of the cases and it resolves within 1 week. Wooferitis that is manifested by lower abdominal pain and vomiting. It occurs in 5% of post-pubertal women with mumps. So the complications includes epididymoorchitis and oophorytis. The sterility after mumps is rare, and there is aseptic meningitis that occurs in less than 10% of the patients and is usually self-limited. The complications less commonly manifestations includes pancreatitis, myocarditis, thyroiditis, nephritis, and arthritis. Now, how will you diagnose and manage the case of mumps? The detection of viral RNA in clinical samples, example buccal, throat swab, CSF, urine, seminal fluid, via reverse transcription, PCR or serology. The mumps is a benign, self-resolving illness. The supportive therapies are most helpful: administration of analgesics and the application of warm or cold compresses to the parotid area. Symptomatic relief with prednisolone may relieve the discomfort of pain. And the prevention is done by vaccination of MMR. So this was all about mumps. In the next lecture, we are going to discuss about measles. This session was powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow.